Think about those medical treatments we often hear about. You have a condition, you take a pill. Seems simple, but
Right.
sometimes the actual impact, well, it can be much bigger or maybe different than you'd expect.
Absolutely. Unexpected effects,
Yeah,
surprising connection.
exactly. And that's kind of what we're diving into today. We're looking at a study that really highlights this exact idea.
We're focusing on statins, those cholesterol-lowering drugs everyone's heard about.
Mm-hmm.
But instead of just their usual role in heart health, which is well known, we're looking at their impact on a very specific group.
Okay, who?
People with peripheral artery disease, PAD,
Mm-hmm.
specifically those who've had procedures like surgery or endovascular work to improve blood flow in their legs.
Ah, right. So interventions to fix blockages. And our source material here is chapter 38 from a book for vascular surgeons, right?
That's the one. And the chapter itself is focused on this really interesting paper. It's called Statin Use Improves Limb Salvage After Intervention for Peripheral Arterial Disease.
Okay. By Parmar and colleagues, published in the Journal of Vascular Surgery.
Yep. And our mission, you could say, for this deep dive is to really unpack why this study is considered, well, pretty important. A landmark paper, even?
What did they actually find? And what does it mean for patients, day to day, and for how doctors think about PI treatment?
Exactly. We're hoping to uncover some of those maybe less obvious connections, find those aha moments.
Okay, let's start with the basics then. We know statins are generally recommended for PID patients anyway, don't we? For their overall health.
We do. That's kind of the standard guidance. Reduces morbidity, mortality, helps prevent heart attacks, strokes. That's pretty established.
So what was the specific gap this study was trying to fill?
Well, the guidelines cover the big cardiovascular stuff, but what wasn't as clear was the direct effect on the limb itself after an intervention. So if you have PAD and you get a procedure to improve blood flow, does taking a statin actually help you avoid meeting an amputation later on? That's the core question, the limb salvage part.
And that's huge for patients. I mean, the fear of amputation must be immense for someone with severe PAD.
It's a major concern, absolutely. So this study wasn't just looking at overall survival, which statins were known to help with. It honed in on this very specific, very critical outcome for the patient's quality of life and mobility.
Okay, so a really crucial question. How did they actually go about investigating it? What kind of study was this?
It was what we call a retrospective observational study.
Meaning looking back at past data.
Exactly. They looked back at the records of 488 patients with PAD. These were all people who'd had either traditional surgery or endovascular procedures, the less invasive techniques on their legs.
Okay, and when was this?
This is between 2009 and 2010, all at one large academic medical center.
Right. So a decent snapshot from that period. And how long did they track these patients? Did they follow up?
They did, and for quite a while, actually, up to 88 months.
Wow, that's over 7 years for some.
Yeah, allows you to see the longer-term outcomes. They looked at things like, well, amputations, obviously, but also overall survival. They used medical records and even linked data to a national death index to get a full picture.
Okay, comprehensive follow-up. So they crunched the numbers.
Yeah.
What did they find? What was the main takeaway about statins?
Well, the core finding was pretty striking, really.
Yeah.
After they accounted for all sorts of other factors like how bad the PAD was, other risk factors like smoking or diabetes, even whether patients were taking antiplatelet drugs like aspirin.
Okay, after controlling for all that.
The patients who were taking statins had significantly better limb salvage rates, fewer amputations.
Significantly better. How much better?
They calculated something called an adjusted hazard ratio. It came out to 0.3.
0.3. Okay. For those of us who don't live and breathe statistics, what does that 0.3 actually suggest?
It suggests a really substantial drop in risk, like potentially a 70% reduction in the hazard of needing an amputation for those on statins compared to those not on statins after accounting for those other factors. It's a big difference.
Wow, okay. That is a big difference. So a major benefit for keeping the limb. Did they find anything else?
They also found that statin use was linked to better overall survival, too, which sort of confirms what we already expected, but seeing it in this specific post-intervention group is still important.
Right.
Interestingly, they also looked at antiplatelet drugs like aspirin or Plavix.
Yeah. What about them?
Well, those did seem to improve survival, but they weren't associated with better limb salvage in this particular analysis.
Huh. So statins helps both survival and limbs, but antiplatelets mainly just survival.
In this study, yes. And another little wrinkle. Using 2 antiplatelet drugs versus just one didn't seem to offer any extra benefit for either survival or limb salvage.
That's really interesting. It really points to statins having potentially a different mechanism, or at least a more pronounced effect on the limb outcome itself.
It does suggest that. They also noted some characteristics of the statin users in their study group.
Oh, yeah. Like what?
They tended to be more often male, white smokers, actually. And they also had higher rates of other conditions: coronary artery disease, hypertension, diabetes.
So maybe the sicker patients overall were more likely to be put on statins already.
Potentially, yeah. It adds a layer of complexity, but the analysis adjusted for many of these things.
Hmm.
And the benefit for limb salvage still held up.
Okay. So what did the study authors themselves say about all this? What was their main conclusion?
Well, their stated objective was clear. Look specifically at statins, limb salvage, and survival after these PAD interventions.
Right.
They were upfront about the study's limitations, of course. Being retrospective, they didn't have perfect data on, say, how well the statins were controlling cholesterol or if patients took their pills every single day. Compliance data is often tricky.
Sure, that makes sense with looking back at records.
Definitely. But they also made a good counterpoint. Other research has shown statins can have benefits even when cholesterol levels aren't particularly high, these so-called pleiotropic effects.
Meaning effects beyond just lowering cholesterol, like reducing inflammation.
Exactly. Things like improving endothelial function, stabilizing plaques, reducing inflammation. Effects that could certainly play a role in limb outcomes after an intervention.
Okay.
So the authors really stressed the impact of their findings. They said this study provides solid evidence that was kind of lacking from really high-quality studies before that statin therapy improves limb-related outcomes. That's a key addition to the known cardiovascular benefits.
And they also touched on something interesting: why we're unlikely to get a big, perfect, randomized controlled trial, an RCT, on this specific question now.
Yeah, that's a really crucial point for understanding why this observational study is so valuable.
Why is that? Why no RCT?
Well, think about it. Guidelines already strongly recommend statins for almost all PAD patients because of the proven benefits for reducing heart attacks and strokes.
Right.
So ethically, it would be very difficult now to design a study where you deliberately don't give statins to a group of PAD patients undergoing intervention just to see if they have worse limb outcomes.
Ah, I see. You can't ethically withhold a treatment that's already considered standard of care for other reasons?
Precisely. So we rely on well-conducted observational studies like this one to give us insights into these more specific effects, like limb salvage.
Okay, so the study strongly suggests this added benefit for limbs. But then there's this other finding that seems, well, a bit worrying. The authors noted that statin use in their study population was actually quite low.
It was surprisingly low, only around 40%.
40%, despite guidelines recommending them for cardiovascular health.
Yep. And they pointed out this isn't just their hospital. Data from a big international registry called REACH showed something similar. Vascular surgeons, specifically, tended to prescribe statins less often than, say, cardiologists.
That does seem counterintuitive. Vascular surgeons are the ones dealing directly with the consequences of PAD in the limbs.
It does seem that way. But historically, managing cholesterol, prescribing statins, that's often fallen into the domain of primary care doctors or cardiologists.
Right. The vascular surgeon might be more focused on the procedure itself, the immediate plumbing fix.
That's often been the case. The authors explicitly state their hope that these findings showing a direct link to better limb outcomes might help bridge that gap. Encourage vascular specialists themselves to be more proactive about ensuring their PAD patients are on statins.
Are there other reasons for this underutilization besides just who traditionally manages what?
Yeah, potentially. There was a big program called Partners PAD Awareness, Risk, and Treatment. Something survival.
Okay.
Anyway, it found that sometimes there's just a general lack of physician awareness, both in diagnosing PAD effectively and in consistently applying all the guideline-recommended medical therapies, which include statins.
So sort of a knowledge gap or maybe an implementation gap?
Could be. And also, maybe that historical focus primarily on the limb itself, rather than the whole cardiovascular picture, played a role. If your main goal felt like fixing the blockage, maybe thinking about cholesterol management felt secondary.
I can see how that might happen in practice.
But interestingly, the study did find that patients who were getting antiplatelet therapy were also more likely to be on a statin.
Oh. So if the doctor was thinking about one guideline med,
They were more likely to be thinking about the other one, too. It suggests that awareness and adherence to one part of the guidelines might correlate with others.
that makes sense.
And again, the authors hope that showing statins hit both targets, better heart and better limb outcomes, will really boost their use across the board for these patients.
Is there any sense that things are improving? Is awareness growing among vascular surgeons?
The authors seem optimistic. They mention increasing awareness, possibly driven by publications in key journals like the Journal of Vascular Surgery, and also more participation in quality improvement initiatives.
Like registries and best practice programs.
Exactly. They also reference another study by Hooks and colleagues which reinforced this. It showed that PA patients who were already on guideline-recommended meds, including statins at the time they came in for their vascular procedure, actually had better survival rates.
So being on the right meds before the intervention matters too. It highlights that point of contact as really critical.
Absolutely. It's a key opportunity to ensure optimal medical therapy is in place.
Okay, so how does all this fit with the big picture, the current official guidelines?
Well, the authors give a nod to the major guidelines from 2016, the AACC ones, and 2017, the European AACACS ones.
And what do they say?
They basically reinforce the point. Statin therapy is recommended for essentially all patients with PAD, symptomatic or not. The main goal stated in those guidelines is reducing cardiovascular events, heart attacks, strokes, death.
And they even specify the type?
Yeah, they generally recommend high-intensity statins if the patient can tolerate them. So this study we've been discussing doesn't contradict the guidelines at all. It actually provides stronger rationale by adding this significant limb salvage benefit into the mix. It supports and maybe even deepens our understanding of why those guidelines are so important.
Okay, so let's try and boil this down. For you, our listener, what's the really crucial takeaway from this deep dive?
I think the key message is this. If you or someone you know has peripheral artery disease, statins aren't just about protecting the heart, as crucial as that is.
Right.
This study provides really compelling evidence that taking a statin can also significantly improve the chances of keeping your limb, especially if you need a procedure to improve blood flow.
Yeah, that's a powerful connection that maybe isn't always front of mind. It really elevates the importance of statin therapy in this specific group. It's not just good for your heart. It might directly help save your leg.
Exactly. It underscores the need for, consistent screening for PAD and making sure that all eligible patients, especially those heading for an intervention, are actually getting prescribed and taking their statins.
It really does. It moves it from just general prevention to something potentially critical for the direct outcome of their vascular problem.
Which leads us to a final thought for you to consider.
Okay.
Given how clear the benefits seem to be, both from the guidelines for heart health and from studies like this one showing limb benefits, what do you think are the biggest hurdles still standing in the way? Why aren't all eligible PAD patients getting these medications?
Is it patient factors, doctor factors,
Yeah.
system issues?
Maybe all of the above. And thinking beyond just identifying the problems, what kind of innovative approaches or creative solutions could we come up with to really tackle these barriers and make sure these proven benefits reach the patients who need them most?
That's a great question to leave people with. Lots to think about there.